Welcome back. I'm Nurse Educator Chelsea, and today we're going to be talking about potassium, hypokalemia, and hyperkalemia. Potassium is an essential mineral needed by all tissues in the body. It is often referred to as an electrolyte because it carries a small electrical charge used to activate various cell and nerve functions. Potassium is found naturally in many foods, but can also be found in supplements. Its main role in the body is to help maintain normal levels of fluid inside of the cells. Potassium also helps muscles contract and helps support a normal blood pressure. A normal serum potassium level is between 3.5 and 5 milliequivalents per liter. Having a low potassium level is called hypokalemia, while having an elevated potassium level is called hyperkalemia. Hypokalemia is a serum potassium level less than 3.5 milliequivalents per liter. A potassium deficit is potentially life-threatening because every body system is affected. Causes include conditions or medications that can cause potassium loss. These can include medications such as diuretics, corticosteroids, or inhaled albuterol, vomiting, diarrhea, wound drainage, NG tube suction, excessive diaphoresis, kidney disease, excess alcohol consumption, and other causes can include inadequate potassium intake, dilution of serum potassium, which could be related to too much IV fluids that do not contain potassium, and movement of potassium from extracellular to intracellular fluid, such as can be found with alkalosis and hyperinsulinism. Symptoms of hypokalemia can include fatigue, muscle weakness or spasms, numbness and tingling, constipation, or palpitations. In more severe cases of hypokalemia, we can see excessive thirst, excessive urination, lightheadedness, low blood pressure, muscle twitches, muscle cramps, confusion, and extreme weakness. Hypokalemia can also cause cardiac arrhythmias or other EKG changes. On the screen now, you can see common changes found with hypokalemia. These can include depressed ST segment, development of a U wave, or prolonged QT interval. Additionally, we can also see PVCs or ventricular fibrillation in cases of hypokalemia. Testing for hypokalemia includes checking serum potassium levels, and we'll also be getting EKGs to check for these EKG changes or cardiac arrhythmias. Treatment for hypokalemia includes replacing potassium, which could be through an oral supplement or through an IV infusion. Keep in mind that IV potassium is a vesicant. A central line is preferred, but if a peripheral line is used, make sure to run concurrently with normal saline or another compatible IV fluid to dilute the potassium to decrease its vesicant qualities. Another thing that can be done to treat hypokalemia is to address the cause, such as nausea, vomiting, or medications. Up next is hyperkalemia. Hyperkalemia is when the serum potassium level is above 5 milliequivalents per liter. This can also be life-threatening. About 75% of the time, the cause of hyperkalemia is due to renal failure, but other causes can include acidosis, severe trauma or burns, infection, Addison's disease, dehydration, elderly taking potassium-sparing diuretics, and excess use of table salt or antacids. Symptoms of hyperkalemia can include nausea, vomiting, diarrhea, tingling skin, numbness in hands or feet, weakness, confusion, palpitations, shortness of breath, and chest pain. EKG changes and cardiac arrhythmias can also be seen with hyperkalemia. Commonly, we can see a widened QRS, a prolonged PR, widened P waves. The P wave may disappear, and we may also see a systole or ventricular fibrillation. Testing for hyperkalemia includes monitoring the serum potassium level through blood work and also checking an EKG for changes or for cardiac arrhythmias. Treatment for hyperkalemia can include IV push regular insulin given along with dextrose to prevent hypoglycemia. We can also give nebulized albuterol. Additionally, we could also use Kayexalate, sodium bicarbonate, and in cases where patients are on dialysis, the dialysis can also be used to manage potassium levels. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.